All right, welcome to the Palm Beach County Emergency Operations Center. My name is Dave Kerner, serving as County Mayor. It is March 17th, 2021. Today marks a special day, not just because it's St. Patrick's Day, and happy St. Patrick's Day, but also today marks a year and a day since the level 2 activation started. Is it a year and a day? So we are into our second year here in Palm Beach County and really throughout the world in our combat against the COVID pandemic. I'd like to title this chapter, and hopefully the board agrees with me, which is Let's Finish What We Started. We've all been through this together. We know what we've been through, we know what we're going through, and we know we have a little bit of a ways to go. And so that's the message and that's the theme. We wanted to have a press conference on the symbolic day, St. Patrick's Day, a year and a day into it. I am joined by our Chief of Fire Rescue to my left and your right, Chief Duran, joined by County Commissioner Mac Bernard, County Commissioner Maria Sachs, County Commissioner Maria Marino, Dr. Alonso, who's the Director of the Florida Department of Health here in Palm Beach County, and our Incident Commander, Ms. Virginia Baker. Right now, Palm Beach County is leading in vaccinations. The latest data reports that 348,293 Palm Beach County residents have been vaccinated thus far, which is 74%, or 257,000 of those individuals that are 65 and up. So 74% of that number are over the age of 65. There's 346,000 Palm Beach County residents that are 65 plus. So 74% of our 65 plus population has been vaccinated. We have great news from the state of Florida Department of Emergency Management in that there will be, and this will be administered by the state of Florida, so we won't be able to answer all the questions, although I'm sure Dr. Alonso will have more information. There's going to be a homebound program for seniors that are homebound. The state and the county will assist in going directly to that senior's home to ensure that they get inoculated and work directly with them. If you're interested, or you have a family member that's interested in booking an appointment, that email address, and we'll make sure to put this on the website if it's not there already, is homeboundvaccine@em.myflorida.com. I'm going to repeat that. It's homeboundvaccine, HOMEBOUNDVACCINE @em.myflorida.com. And you can send an email there with your request. I think the turnaround time, I don't know that they're booking appointments right at this moment, but you will be contacted by somebody from the State of Florida Division of Emergency Management within 72 hours, I believe is the standard. I would like to advise the county that the facial covering, the mandatory facial covering mandate is in effect in this county still. It's been extended for another 30 days. I know that there's been a lot of questions about the necessity for masks at this point. Obviously, we have heard and we have seen how important, as a mitigation strategy, facial masks are. We've had great participation, great compliance in this county. We hope collectively that that will continues. It is the law here in Palm Beach County, and we ask that you follow it. However, my experience has been widespread use of the mask because people know that it keeps them safe, and they know that it keeps the neighbor and their family safe, and that's really what this is all about. We also are approaching spring break. We've seen some very concerning images, quite frankly, from, I think it's South Beach or the coastal area in Miami-Dade County. We haven't experienced the neighbor and their family safe, and that's really what this is all about. We also are approaching spring break. We've seen some very concerning images, quite frankly, from, I think it's South Beach or the coastal area in Miami-Dade County. We haven't experienced that effect here in Palm Beach County, but we ask that our hospitality industry, our restaurants continue to be great partners in making sure that the patrons are wearing masks and that we're abiding by all the regulations. Remember, let's finish what we started. We're going to hear from Dr. Alonso about some variants in the COVID strain. I certainly can't comment on that with to any degree, but that is what you're going to be speaking about, correct?
Yes.
And then also we're going to have Chief Duren speak about some of the partnerships that we have with our local law enforcement agencies, and we'll hear from them in just a minute. Before I turn it over to Dr. Alonso, I wanted to also report that the COVID education and compliance team does remain in force and effect. They are still continuing to go out into the community. I get asked all the time, is the COVID education team still doing their job? Absolutely. Obviously, at this point, a year and a day in, the emphasis has always been education, education, education. And at this point, I don't think that there's anybody that doesn't really understand what the necessary mitigation strategies are to keep each other safe. But our team is still out there. They deliver resources, they deliver information, they clarify the guidelines, and we appreciate their hard work. I would also like to direct your attention to what I think is a very fascinating map. To my left, you can see it on the screen. This is a map that was produced by our Emergency Management Department, and it was done at the request and direction of the Board of County Commissioners. What it does show is the rates of vaccination for people over 65 by zip code. And you can see that the what do we call it, the garnet color is the highest rate of vaccination. So in the areas that are garnet, it's 85% to 100% vaccination, and then dark blue goes down from there. And so the map is showing sort of how the vaccination strategies unfold in our county. Obviously, there's a robust need for the vaccinations, and there's a robust, I would say, desire for them, and we've seen that desire uptick over time as people become more comfortable with getting a vaccine. It shows that we still have work to do. It also depicts in the yellow dots there 81 different sites that you can get vaccinated. And on behalf of Commissioner McKinley, who's hard at work in Tallahassee on our behalf, I wanted to remind our community that we have worked with federal authorities and state authorities to ensure that our rural communities have access to vaccination sites within their community, and that we hope that you respect those boundaries, allow those rural sites to serve the needs of those communities. And if you're going to get vaccinated here in town, go somewhere that is close to where you live. And that way that we protect and allow access to the rural communities in our county, access to the vaccine. So we can answer some questions about what that map really shows, but the bottom line is we have a very robust system of vaccination through our state and federal partners and our county partners, along with pretty high rates of vaccination when it comes to that particular class of 65 and up. We do have this map up on our website, the county website. It will be interactive starting Thursday. That means you can go in and click on the dots, see what that dot represents. It could be a Publix, it could be a CVS, it could be a Walgreens. We also have our site set up at the fairgrounds as well. And so you can go into that map starting on Thursday to learn more about what resources are available to you as a county resident. All right, it's my honor to invite to the podium at this time Dr. Lena Alonso, and then we'll be followed by Chief Reginald Duren. Doctor?
Thank you very much, Mayor. It's my honor to follow you at the podium all the time, and I'm glad to do it. Thank you for all of you being here and helping to spread our word on how we are stopping the spread of the virus. There's I am being very cautiously optimistic, and I want to share what opportunities we have created to end the pandemic. We have to watch this go all the way to the end. We cannot stop and do what we've done 2 times before, where we're getting to the bottom of the peak of our graph, and then all of a sudden we stop doing what we should be doing, and we have another wave. We do not want a 4th wave here in Florida. So I am very grateful for our new COVID cases that are decreasing nationally. And in Palm Beach County, we're now at an average of 359 cases for the last 14 days. That's down from over 1,000 at the peak. The COVID deaths are also decreasing nationally, and indeed, Palm Beach County has a death rate now of 2%, which is equal to that of the state. The hospital COVID admissions have been decreasing, and they have also been decreasing here in Palm Beach County with an average of around 200 per day for the hospitals. 100 million people will be vaccinated prior to the federal target date set by the president. Right now, there's 90 million people vaccinated, which is about 10% of the population of the United States. In Palm Beach County, you just heard, 74% of those over 65 have been vaccinated. That's higher than the metro counties, and that's counties with over 1 million. Broward is at 69% and Dade at 64%. So we've done a very large job with the little bit of vaccine that we have gotten. So how have we been able to do that? Well, first of all, that's been with the cooperation of this county, the county commissioners, thank you, commissioners, fire rescue, and of course an excellent incident commander that has been at our side making sure that we do this right. We're seeing increases of doses across the nation, and in Palm Beach County, our Moderna vaccine has increased from 4,500 to 5,600 per week. And that is because of state vaccine coming in to facilitate 2 facilities that will be permanent. The one in Pahokee that's already in existence, and Wells Recreation that's been announced today. Publix continues to do their vaccinations. They have switched to several of their pharmacies receiving federal supply, and they've made an agreement with the governor to follow the federal rules as opposed to the governor's executive order, where all their Publix will be using the federal rules. That is somewhat relaxed compared to the governor's rules, and so people at Publix will be able to have more access and lower ages, which will make more people be able to get vaccinated. We've also created what the governor has deemed mini missions. Those are targeted at hard-to-reach communities and minorities with additional state vaccine. Those mini missions started out as church-led groups that we knew had been able to talk to their communities and talk to their residents and were trusted sites for them to go get vaccinated. That was very successful. The governor looked at that and has agreed that that is something that he will continue and has been continuing. That brought more state vaccine into our community. FQHCs, with the help of, again, with the help of legislators, has also been applied to receive federal vaccine, and we have 4 federally qualified health centers here in Palm Beach County. That's the healthcare district that has multiple sites, Found Care that also has multiple sites in town, Genesis that's down in Boynton, and of course the one in Pahokee, which was the only one that received a little bit of vaccine early on, the Florida Community Health Center. In addition to that, we continue to urge very persistently to continue to have more state-funded permanent sites in addition to what we have now, and that will add to the supply here in Palm Beach County. And finally, as you heard, the supported strike teams that have come in to do the schools. They did over 1,800 vaccinated school staff. They did it through multiple schools, and we are hoping that they will come back to do the rest of folks that didn't have the opportunity to do it. And so the homebound, in addition to the HUD housing, are also being done by strike teams supported with state vaccine and strike teams with from the state. So all those things have added to the ability for us to be where we are in terms of leading the other counties in terms of our vaccination rate. And finally, the federal pharmacy program, with a target of over 40,000 pharmacies, will eventually allow the public health system and the local communities' efforts to get back to normal work as they take over the areas where they vaccinate, and we can concentrate on going out to the small sites and mobile units to take care of those underserved areas. Now, all this is very positive, but why am I saying that I'm just cautiously optimistic? Because there's still threats for a 4th wave of COVID to hit the United States. Italy right now is on shutdown because they have hit another high. First of all, the vaccination is making people ignore the mask distancing, and there's fatigue. All of us feel it. It's very important that even when you're vaccinated, that while you may maintain your close circle of family, that once you go out, you continue to use your mask. The vaccine is only 95% effective, which is fantastic, but there are breakthroughs in people that have gotten vaccinated. Very, very small, but there are breakthroughs. So we need to protect each other and the public. There's also increase in travel. TSA recorded the highest passenger screening in a single day since March of 2020, and that was last Friday. While it's great to be able to visit loved ones now with vaccine, keep in mind that where you're dining, visiting, or traveling, those people may not have vaccinated. So please continue to wear your mask and watch your distance. Spring break. We talked about spring break, summer vacation, upcoming hurricane season. These are all events that could spread the virus further. States that are opening too soon or eliminating precautions will also spread the virus. Segments of the population that are refusing the vaccine remain very high in some areas, as high as 40%. I think those numbers will come down because as people see that people are tolerating the vaccine well, they will get vaccinated. But sometimes people need time to make that decision, so we need to be patient. We will not be safe until there's total global herd immunity. And of course, immunity here in the United States. The COVID variant is something I want to speak a little bit about because it's increasing worldwide and it could become the dominant virus, and that is great concern for all of us in the health department and all of us at the CDC and the World Health Organization. In Florida, we have, if you go to the CDC website, cdc.gov, and you search for COVID variant report, you will see that Florida has the highest number of variant cases of all the states in the United States. They break it down. It's interactive. You break it down. The UK variant is the most prolific variant. Florida has 738 cases of the UK variant. The next state with the highest number is Michigan. They have 616. And then California, 375. So what does that mean for us here in Palm Beach County? Florida has 850 variants in Florida. We have the three different ones here. In the UK has 821 cases. The Brazil variant has 20, and the South Africa variant has 9. 32 of those cases have had hospitalizations. The age distribution is the same as for those of the COVID virus, which is the 15 to 44-year-olds that are being, lax in terms of their mask wearing and doing risky behavior. In terms of our counties, Palm Beach County is number 3 with 75 variants. That's an increase of 5 since the day before. Dade is at 129 with an increase of 6, and Broward is at 307 with an increase of 19 variant cases from the day before. Pinellas is at 42, and then the other Metro County Orange is at 17. 5 people have died with the variant. Now that's a small number, but it is significant. Of those, all of the individuals that have died were hospitalized, and none had any travel history. 3 of the 4 had contacts with known cases of the variant UK virus. 1 had no information in terms of contact. We could not find where he came in contact with the virus. 2 of the individuals are from Broward. There's a 97-year-old female and a 93-year-old female from Broward. Pinellas has the youngest case with a 42-year-old female, and Leon County has a 63-year-old male. That's the one that had no contact information. The 5th individual has not been determined yet, and I have no information on that case. So this is why we need to continue our strategies to educate, promote, and protect. And how are we going to do that? We need to have local community outreach needed to inform about the benefits of the vaccine in a non-judgmental and trusted fashion. We need to have national and local multimedia campaigns to stop the spread of the virus, emphasizing the wearing of the mask, the washing of your hands, and maintaining distancing. This has to continue if we're going to stop the spread. We must continue to increase access to hard-to-reach and isolated communities or individuals with local and state help. We should create targeted strategies for businesses, schools, recreation facilities to maintain or enhance the safety precautions to stop the spread of the virus. If we want to make sure that our businesses stay open and that we're having a robust economy, it is imperative that we keep these only methods that we have to stop the spread of the virus. It is very, very important. And finally, again, the federally pharmacy program, as it expands, local resources will switch from mass vaccination to targeted pockets of need, and finally allow us to get back to our normal work, which continues every day, and we have not stopped doing that. So with that, I'll entertain any questions that you may have.
Dr. Alonso, Broward County had announced a few days ago that they were going to start vaccinating all teachers of any age, even at county sites. How are they able to do that with the executive order the governor has put in place? Is that something that Palm Beach County
Do you want to hold that just 1 second so I can get Chief Duran to please come up and speak? You want to do that? And then we'll take the questions afterwards? Thanks.
Thank you, Dr. Alonso. Palm Beach County Fire Rescue continues to work with county agencies to mitigate the effects of COVID-19. As many of you are aware, we're very active in the testing process. We've already taken care of assuring that our firefighters, as well as our municipal partners, have been vaccinated as they should be. We're also working now with the police and sheriff's departments to assure that the municipal agencies can support efforts along with us to assure vaccinations for all the police and sheriff's officers that meet the governor's current executive order. We'll continue to provide resources as needed to support the healthcare district as they seek to continue to vaccinate its community, and we look forward to the continued support of the Board of County Commissioners and Mayor Kerner as well. Mayor?
Many thanks to Dr. Alonso and Chief Duran. I'm also joined by 3 members of the Board of County Commissioners. As I said, Commissioner Mac Bernard, Commissioner Maria Marino, Commissioner Maria Sachs. I want to give them an opportunity to speak. So if we'll start to my right, Commissioner Sachs, if you had any comments.
It's hard to wear glasses and a mask at the same time, but I'll try it. Good afternoon, everybody. Thank you very much, Mayor O'Kerner. So happy to have you with us and to make sure that we all celebrate St. Patty's Day in the way that we should. Let me say that now I feel like we're in COVID comeback. We have successfully campaigned, all of us in the county, all of our leaders in the county, as well as the departments under us, to fight this horrendous pandemic of which we have never seen the like in our lifetime. And this, we fought it like a military campaign. And I want to thank all of our county, my fellow county commissioners, as well as Ms. Baker and Dr. Alonso and Chief Durnan. The firefighters have been amazing. If you look to see the areas on the map that have the largest concentration of folks over 65, that happens to be in the middle of my district, and I'm very proud to tell you that at the first rollout here in the county was in 2 of our most populated senior communities of Kings Point and Century Village. The rollout went extremely well, and that was because of the partnership between the county, the state, law enforcement, our fire department. So we're going to continue to do this. We are, however, I caution everybody, this is like the 7th inning stretch. We've got a couple more innings to go before we finish with this comeback. And everyone's watching us. I spoke to family today in Ireland. They are in lockdown again. Pubs are closed, the restaurants are closed. Folks in Ireland are not able to go beyond 5 kilometers from their homes. Folks are watching us throughout the world. We're doing well, but we are strong and resilient. We're not there yet. We're going to continue to be strong. We're going to continue to do the one thing that will completely stop this pandemic, and that's mask, wash your hands, social distance. So for the people who are watching this in our county, continue to be strong. We are stronger together than ever before. And we will get through this, and we'll get through it healthy and prosperous and alive. Thank you very much. Thank you. Thank you, Mayor.
Good afternoon, all. Happy St. Patrick's Day. Maria Marino, Commission District 1. I will have just a little comment, and it is about one of our homebound seniors. Last week, I had been contacted by a young lady who lives out of state looking for her 94-year-old grandmother who has a broken femur and cannot possibly leave her house. So put her in touch with the vaccine website for homebound seniors. She did that on Friday. She contacted me this morning to say that her grandmother had been vaccinated already. So if you want to know if the site is up and running and working, I can happily say yes, it is. Continue the fight, continue to wear your masks. One more comment, it is about a bill that's up in Tallahassee right now, and it is discussing emergency orders and how Tallahassee is trying to preempt local authority, home rule authority on emergency powers. So why is that important? Because government closest to you is the one that's most effective, and we as your county government are closest to you. So I would encourage you to contact your local senators and representatives to say, no, we do not want emergency powers taken away from our local authorities. Have a great day.
Good afternoon. My name is Mac Bernard, County Commissioner for District 7. Just want to thank our Incident Commander, Virginia Baker, for the work that she's doing on behalf of the residents of Palm Beach County, the mayor. As we've seen with the maps, there are some areas that we still have to continue to work in the county that needs to be vaccinated. So we're going to work hard and diligently to make sure that we have more access to more sites and for us to continue to reach some of the hard-to-reach areas. It's St. Patty's Day. My kids are home and they're causing trouble, but I hope they're not watching. But as we're enjoying spring break, we're asking our residents to continue to practice social distancing, continue to stay safe, and wear your mask. Thank you very much.
Excellent messages from my colleagues on the Board of County Commissioners. I feel compelled, I'm not sure why, but I feel compelled to again remind you to have a safe St. Patrick's Day. But what I feel compelled to tell you is that my Chief of Staff, Dave Bernhardt, is here, and he's in a kilt, and we greatly appreciate your service, sir. We also, the state of Florida is the crossroads of the United States, and you see how many variants we have. Dr. Alonso spoke about that. We are the crossroads between South America, Central America, our neighbors across the pond in Europe. We have a lot of visitors, and our economy is very much intertwined with our ability to have tourists here safely. And for example, we have the Honda Classic, which is here in town. CEO Ken Kennerly and I have met on many occasions to look at the efficacy of their safety plan. I am highly impressed with how much detail has been spent on making sure that participants and the golfers and the security staff and from top to bottom, everybody is safe. But Palm Beach County leads the way. And this is important to our recovery, because when I say let's finish what we started, the next chapter after that is economic recovery. And so we're delighted to have an event like the Honda Classic here in Palm Beach County, because we have proven that we can do it safely. And as we go out into that festive spirit with spring break, with family coming into town, with people trying to escape from other states where they're still shut down, remember that we've had the blessings and benefit of having our schools open the longest, our economy open the longest, and our positivity rate consistently very low here in these final innings, as Commissioner Sachs alluded to. So I thank you on this first day of the second year of what has been one of the most trying times in American history. I am honored to share this podium with my colleagues on the board, and Dr. Alonso and our incident commander and county administrator, Ms. Virginia Baker, but a particular and heartfelt thanks to the members of Palm Beach County and the residents of Palm Beach County for going through this pandemic with us and for allowing us to be a part of the team that will help us recover as a community. With that said, we'll take any questions. If you wanted to go back to Dr. Alonso.
Dr. Alonso, I'll repeat the question. So we have read that Broward County is opening up vaccines for teachers for all ages. They made the announcement a few days ago. My question was, how are they able to do that when you're following the governor's executive order?
The question is, how is Broward opening the vaccinations to teachers, to school staff of all ages? They're doing that because of the federal vaccine that they're receiving. So the federal sites, like Publix, has decided to follow the federal rules. So that is how they're doing it. The federal rules does not have the exception for age.
And we don't receive any county vaccines.
We have no
is that
federal
right?
sites here in Palm Beach County.
And then one quick follow-up question for you, Dr. Alonso. So it's come to our attention that lifeguards who are not EMTs are not qualifying under that medical emergency category. Is there any way for them to get the vaccine as well, given that they are first responders?
They can probably get it through the federal sites, as that might be a possibility, but they cannot get it through us or through the vaccine that we have from the state,
Because of state regulations?
this executive order.
Dr. Alonso, Mayor Kerner touched briefly on it, but what is the medical theory as to why Florida is leading in the country in the number of variant cases?
The medical theory is just that, it's a theory, we don't really know. I believe it has to do with exactly what the mayor talked about, that we are a crossroad. Broward certainly has a lot more international travel than we do, and Miami also. It also has to do with how many people are testing for it, okay? Because in order to test for the variant, you have to go through the DOH epidemiology department. We send that to the state with the conditions and the qualifications that are required in terms of suspect for it to be a variant. And then that has to go to CDC for approval by CDC to order the test. So it goes through some rigorous criteria before it can be done. So perhaps we're a little bit more aggressive in Florida because we have a great epidemiology department in the Department of Health, which is the best probably in all the U.S. But I think it has a lot more to do also with the fact that we are the crossroads and there's a lot of international communication, even if these people had not traveled. The fact that it has to be tested means there's a lot more variant virus than what we're counting, because those are the only ones that have been tested. So that's why I love the seventh inning because I love baseball. So we have got to stick with this. We have got to stick with the mask, even if I did forget to take it over with me. But it's so important because of that. And we do not want this variant to become dominant. That will be catastrophic. That could also cause mutations that go beyond the regular mutations and therefore the vaccine not become effective. So that has not happened yet. I'm not trying to be an alarmist. I'm just trying to be very realistic that those are all possibilities that all of us in public health and the CDC are concerned about. So please help us.
Dr. Alonso, you mentioned that you want to expand access to vaccines with more state-funded sites. What did you have in mind and where would those sites be?
The question is that we want to expand more vaccine coming into Palm Beach County with state sites. That would be, an example, is the Pahokee site that is being run by state staff. It's being run with state vaccines, so it doesn't cut into the limited amount of vaccine that we have. It also means Wells Recreation Center. It proved itself to be a very effective, run by Fire Rescue. Fire Rescue in Riviera Beach stepped up to the plate, say we want to do this. We want to make this a community-friendly area, that people trust us, that people come to us. The recreation center is a trusted site for people to come to. And that becomes the most effective way to get the community to buy in to the vaccine, is that kind of local trust. And urging, again, with trust and with not being judgmental. It's very important that we message that people have to be ready to get the vaccine. And I think the longer we educate and the longer we trust people, that they will make the right decision when the time comes.
And a follow-up question there. On that map, we see that kind of the majority of the vaccine has been concentrated to the South County area, or it looks like at least more people down there are getting access. Is that because there is more access down there, or is that a function of interest in the area?
Let me answer that. That's the wrong interpretation of the map.
Okay.
This map shows the percentage of 65 and over that have gotten vaccinated per zip code.
Okay.
Okay? So that is telling you that those red zones out in Canal Point, in the west part there of those senior communities, and down towards Kings Point and so forth, a lot of that population has been vaccinated. And it makes sense, because that's where your elderly are. So that percentage is close to between 80 to 100% of the population over 65 that has been vaccinated. It's not the number of cases, it's not the number that have been vaccinated.
It's also
Mayor.
because of the Broward sites, everybody lives in the Broward sites.
Yeah, see, that's why we all need help from one another. Also, the South End obviously is in contact with Broward, that has the federal sites, and they're vaccinating everybody. So a lot of people have gone to the South. As a matter of fact, we're encouraging people to go to the federal sites. They don't have appointments, you drive through, you have to wait, you get in line, but they're much more relaxed, and people actually are getting vaccinated at those sites effectively. Next.
Mayor, you mentioned the mask mandate has been extended for 30 days, and obviously we've heard today how there's concern with the variants and everything else going on. Are there any parameters or any type of situation that you're looking at in the future of when you might consider removing that mandate or loosening those restrictions? Is there a goal in mind to get to that point?
The question is there a goal or a time frame in mind for the removal of the mask mandate? I can't speak on behalf of the Board of County Commissioners, and we will meet in public, and at any time, a member of the board can bring that issue up. Until then, we've delegated that authority to our county administrator, and my advice to her and my direction has been to continue the mask mandate. And I think there's sort of a strong consensus on the board that it is the most effective mitigation strategy. Having said that, at some point, the mandate will be lifted. I don't have a time frame in mind. I'm solely focused on people getting vaccinated and wearing my mask wherever I go, because let's finish what we started, first of all. But second of all, we hear from President Biden, we hear from Dr. Fauci, that people that are vaccinated, that have a false sense of security, can actually be a host and a carrier of these new variants and transmit that to other people. And that's the last thing we want to do in this final inning. When we hear Dr. Alonso talk about how potent this new strain is, and if we allow it to spread out of control in our community, we're going to have to go through that another cycle that we don't deserve to go through, that we have the power to stop in our own community. So as far as I'm concerned, it's not a lot to ask this community, and they've stood by us shoulder to shoulder in wearing these masks, and we don't have a time certain for when that's going to end. But when it is time to end it, we will. And it will be at the appropriate time with the medical advice and opinions of those that have the knowledge and information. All right, no further questions. I hope you have a wonderful St. Patrick's Day. Thank you to the press for covering this. This is part of our continuing commitment to be candid, honest, and open with our constituents and residents on the progress of our operations on COVID-19. Thank you for being here today. We'll continue to communicate with the community moving forward as we always do. Thank you.